Could working the night shift be quietly shortening your life? Large scale epidemiological and longitudinal studies have followed night shift and rotating shift workers for many years, and the findings deserve our attention. Compared with people who work predominantly during the day, night workers appear to have higher risks of premature death, cardiovascular disease, metabolic disorders, sleep problems, and certain cancers. A systematic review and meta analysis found that night work was associated with increased all cause, cardiovascular, and cancer mortality, although the degree of risk varied according to the duration, frequency, and pattern of shift work. You may have heard the claim that night shift workers lose 15 years of life. That exact number has not been consistently demonstrated in high quality research and should not be presented as a universal outcome. However, this does not mean the health threat is insignificant. The evidence indicates that years of repeated night work may increase the likelihood of developing diseases that can shorten both lifespan and health span. In fact, the International Agency for Research on Cancer, the Cancer Agency of the World Health Organization, has classified night shift work as Group 2A, probably carcinogenic to humans. The human cancers considered included breast, prostate, colon, and rectal cancers. This does not mean that every person who works at night will develop cancer. Risk may be influenced by how many years a person has worked at night, the number of consecutive night shifts, the frequency of schedule changes, sleep duration, light exposure, metabolic health, smoking, alcohol use, dietary pattern, physical activity, and genetic susceptibility. But why might night work affect so many systems in the body? It is not simply the number of hours you work. It is what happens inside your body when your circadian rhythm is repeatedly disrupted. Your body has an internal biological clock that helps coordinate sleep and wakefulness, hormone secretion, body temperature, blood pressure, glucose metabolism, digestion, cellular repair, and immune activity. This clock expects light, food, activity, and social interaction mainly during the day, and darkness, fasting, rest, and repair at night. When you remain awake under artificial light, eat meals, experience stress, and perform demanding work during your biological night, your behavior may become misaligned with the timing signals programmed into your physiology. You may be awake when your brain and organs are preparing for sleep, and you may be trying to sleep during the day when light, noise, heat, family responsibilities, and natural circadian alerting signals are telling your body to remain awake. This creates more than simple tiredness. Chronic circadian disruption may contribute to abnormal glucose regulation, insulin resistance, elevated blood pressure, inflammation, hormonal disturbance, oxidative stress, impaired DNA repair, and changes in immune function. These mechanisms may help explain why long-term night work has been associated with cardiovascular disease, obesity, type 2 diabetes, and certain cancers. Recent meta-analytic evidence continues to associate night shift work with increased cardiovascular events and cardiovascular mortality. Your immune system may also be affected. Natural killer cells, or NK cells, are part of the body's rapid immune defense. They help identify and destroy virus-infected cells and abnormal cells that may potentially develop into tumors. Their number, movement, and activity are influenced by sleep, stress hormones, and circadian timing. In a controlled human experiment, participants were deprived of sleep. After this partial night of sleep deprivation, average NK cell activity fell to approximately 72% of the participants' baseline level. It provides biological evidence that even a single night of disrupted sleep can temporarily alter natural immune activity. Natural killer cells are only one component of cancer surveillance. The relationship between sleep, immunity, and cancer is complex. Cancer development cannot be attributed to one immune measurement alone. However, repeated sleep loss, circadian misalignment, altered melatonin signaling, inflammation, metabolic dysfunction, and impaired cellular repair may collectively create a biological environment that is less favorable for long-term health. The good news is that working the night shift does not make disease inevitable. Many healthcare professionals, emergency responders, factory workers, security personnel, transportation workers, and service employees cannot simply stop working at night. The goal of lifestyle medicine is not to blame workers for a schedule they may be unable to control. The goal is to reduce modifiable risks, strengthen physiological resilience, and develop a realistic plan around the person's actual work demands. What can lifestyle medicine offer night shift workers? First, protect sleep as a medical priority, not as leftover time. Aim for a sufficient total amount of sleep within every 24-hour period. Most adults require approximately 7 to 9 hours, although individual needs vary. For some shift workers, this may involve one main sleep period combined with a planned nap. After the shift, create a deliberate transition toward sleep. Reduce unnecessary light exposure. Keep the bedroom cool, quiet, and dark. Use blackout curtains or an eye mask. Silence notifications. And ask household members to protect your sleep period whenever possible. Consistency also matters. Constantly switching between a daytime schedule and a nighttime schedule can repeatedly force the biological clock in opposing directions. When scheduling flexibility exists, workers and employers should consider limiting rapid shift changes, avoiding excessively long duties, allowing adequate recovery between shifts, and reducing repeated transitions from night duty to early morning duty. Second, use light strategically. Light is one of the strongest signals controlling the circadian clock. Brighter light during the earlier and middle portions of a night shift may improve alertness for some workers. In contrast, reducing bright light exposure after the shift may make daytime sleep easier. Systematic reviews suggest that appropriately timed lighting interventions can reduce sleepiness among night shift workers. However, light timing should be individualized because poorly timed bright light can worsen circadian misalignment or make sleep more difficult. A lifestyle medicine physician or sleep specialist can help determine when greater light exposure may be useful and when dim light, sunglasses during the commute, reduced screen brightness, or a dark sleep environment may be more appropriate. Third, be intentional about meal timing. Your digestive system, pancreas, liver, muscles, and metabolic hormones also follow circadian rhythms. Eating a large calorie-dense meal during the biological night may produce a different glucose and metabolic response than eating the same meal during the day. When practical, consume the largest and most nutrient-dense meals before the shift or during the earlier part of the waking period. During the biological night, choose lighter meals or snacks rather than large servings of fried food, refined carbohydrates, sugary drinks, processed meat, or highly processed convenience foods. A high fiber, minimally processed, plant predominant dietary pattern can help support weight management, glucose control, cardiovascular health, bowel regularity, and overall dietary quality. Useful night shift options include vegetables, fruits, beans, lentils, tofu, minimally processed whole grains, nuts, seeds, and other foods that are easy to prepare and carry. Planning matters because fatigue makes highly processed food more tempting. Bringing prepared meals can reduce dependence on vending machine food, fast food, sweetened coffee, and sugary energy drinks. Fourth, use caffeine carefully rather than continuously. Caffeine can temporarily improve alertness, but it does not replace sleep. Repeated caffeine intake toward the end of a shift may delay sleep after arriving home and can create a cycle of poor sleep, followed by greater caffeine dependence. When caffeine is used, it is generally more sensible to take a modest amount during the earlier part of the shift and avoid it for several hours before the intended sleep period. People with palpitations, uncontrolled hypertension, anxiety, pregnancy, reflux disease, or certain medications may require more individualized advice. Fifth, schedule physical activity. Regular exercise supports cardiovascular fitness, insulin sensitivity, weight management, stress regulation, mood, and sleep quality. A night shift worker does not need an exhausting workout after every duty. Even brief activity performed consistently can be meaningful. Options may include walking before the shift, short movement breaks during work, resistance exercises on off days, cycling, swimming, or structured aerobic activity. Exercise timing should be adjusted to the individual. Vigorous activity immediately before planned sleep may be stimulating for some people, while others sleep better after moderate exercise. Sixth, manage stress and protect social connection. Shift work can interfere with family meals, worship, friendships, parenting, community activities, and time with a spouse or partner. Social isolation and chronic stress can worsen sleep, emotional well being, eating behavior, and cardiovascular risk. Lifestyle medicine care should therefore include stress management strategies and intentional social connection. These may involve breathing exercises, prayer or meditation, relaxation routines, journaling, counseling, time in nature, family scheduling, peer support, and protected periods for meaningful relationships. Seventh, avoid substances that worsen sleep and health risk. Alcohol may initially make a person feel sleepy, but it can fragment sleep and reduce sleep quality. Nicotine is stimulating and is a major independent cause of cardiovascular disease and cancer. Sedative medications should not be used routinely without medical supervision, particularly in workers who drive, operate equipment, or perform safety sensitive tasks. Melatonin may be useful in selected circumstances, but it is not appropriate for everyone. Product quality, dosage, timing, interactions, and next day drowsiness must be considered. It should be discussed with a qualified physician rather than treated as a universal solution. Eighth, undergo appropriate health screening. Night shift workers may benefit from regular assessment of blood pressure, weight and waist circumference, fasting glucose or HbA1c, lipid profile, sleep quality, mood, and symptoms of obstructive sleep apnea. Cancer screening should follow age, sex, family history, and country appropriate clinical guidelines. Persistent difficulty sleeping, severe daytime sleepiness, near miss accidents, loud snoring, witnessed pauses in breathing, morning headaches, depression, or reliance on stimulants or sedatives should be evaluated. Some individuals may have shift work sleep disorder or another condition requiring specialized management. Finally, employers also carry responsibility. This cannot be solved entirely by telling workers to practice better sleep hygiene. Workplaces should examine staffing levels, length of shifts, number of consecutive night duties, recovery time, access to nutritious food, availability of rest breaks, fatigue management policies, lighting, transport safety, and opportunities for health screening. Healthier scheduling and workplace interventions are part of lifestyle medicine because the environment strongly influences behavior. A person cannot fully compensate for unsafe working conditions through individual willpower alone. So, if you regularly work at night or rotate between day and night duty, do not simply accept exhaustion as part of the job. This is a conversation worth having with your lifestyle medicine doctor. You may not be able to change the fact that you work at night, but you can change how intentionally you protect your health while doing it.